Victoria has recorded a relatively big jump in COVID cases for Victoria in this current outbreak. 120 locally acquired infections have been confirmed. 56 are under investigation. The state has recorded its first deaths of the outbreak. It was announced yesterday that 2 women had died at home. The Andrews government is expected to detail a pathway for the easing of restrictions while the vaccination rate edges high. We're expecting that information from the Premier today. Reporter Steph Ferrier joins us now from Melbourne. Steph, so unfortunately the biggest number of this current outbreak.
Yes, good morning, Joe. It's pretty sad. When we all heard the numbers, there was definitely a little bit of a down mood here, unfortunately. 120 new cases. And as you mentioned, just 64 of those are linked to the current outbreaks. That means that they still haven't yet been able to track how 56 of those are there. More importantly, we still don't have the numbers or the breakdown yet as to how many of those 120 cases were actually in isolation while they were infectious. One hopes that a lot of these might have been in terms of the day 13 testing that would have been happening for a lot of those thousands of people that have been isolating in Shepparton in the state's north. They're coming up to that, but the majority or the bulk of those will be coming up on Thursday, not today. And obviously we're now also cracking 900 active cases as well. So the majority of those would be involved in this current outbreak. There was only a handful of them yesterday that had actually been acquired overseas out of our active cases. Now, this means that the last time that we actually cracked the 100 mark or went into triple digits was back on September the 2nd at the tail end of our deadly second wave when we had 110 cases. The last time that we've actually had as many cases as this was back on August the 25th last year, and that was when we hit 142 as we were coming down from that second wave too. So it's definitely not great figures for us as we look to a roadmap towards coming out of this lockdown 6. And of course we also have to look at the testing numbers. At least they were really high. So we had 56,501 test results processed. So it is good that a lot of Victorians are still coming out in their droves to get tested. The vaccination rates were 33,500 that were done in state-run hubs. That's not, of course, counting all of the GPs and pharmacy networks that we have going at the moment, particularly with the new Pfizer bookings being available for the 16 and overs in those facilities now as well.
And Seth, has the language changed from authorities there in Victoria about getting back to zero?
It definitely has changed. Earlier on we heard Daniel Andrews talking about the fact that we would be able to beat Delta again. We had beaten it before and we could get down. You remember we only had one small brief moment. It wasn't even a full day, I don't think, of 0 cases before the cases picked up again in the afternoon and we were plunged back into lockdown again on August the 5th. That came in on August the 6th. It was supposed to be a 7-day circuit breaker and here we are 27 days later waiting for the government to sign off on the blueprint to get out of this, and it's expected that they will reveal the details of what Victorians can look forward to as the cases ease again. And we have seen that language, as you say, really change, because now what the Premier is saying that even if we don't get down to zero, previously it was always getting back to 0 cases, but he's saying that it wasn't so much a matter of potentially getting down, it's what sort of low numbers we can tolerate being the thresholds. That's what he was referring to, and one would have to think that those numbers would be relatively low. However, everything was all on the table, so there is the possibility that we might see eased restrictions like the ban on playgrounds at the moment coming off. Also some of those COVID-free areas of regional Victoria outside of that Shepparton and surround areas being able to potentially open up. Also up for review was the nighttime curfew. That's still in force from 9 p.m. till 5 a.m. every day. And also the possibility that we could be able to travel a little bit further than 5 kilometres from our home. That could be doubled to 10 kilometres. But the Premier did say that we weren't going to see any return of all students back to classrooms anytime soon, which is a real blow for many parents, children and teachers as well that are having to go through home learning once again. And also we will not see any crowds at the MCG. So for the second year in a row, the AFL Grand Final is going to be heading interstate, this time to Perth. Not just that, but the entire festivities that surround it, being the Grand Final ticker tape parade, as well as the Brownlow Medal Night. You know, football is a bit of a religion here, and unfortunately Victorians won't be able to partake in that. However, we will still have the AFL Grand Final holiday, the public holiday that's been gazetted. The Premier is saying that perhaps that should be a moment to spend more time with your family, or even a go get vaccinated day, because we want to see those vaccinations increase from around about the 35% or so of the adult Victorian population here that has received those 2 jabs.
And Steph, a sad day yesterday with the announcement of those deaths.
Yes, this was really tragic news to hear that this is the first time for this year that we have seen any COVID-related deaths. This was a woman aged in her 60s from the local government area of Hume, and also a woman aged in her 40s from Northcote, both in Melbourne's northern suburbs. And we haven't been told by the Health Department whether or not they were vaccinated or whether or not they had any other underlying medical conditions that could have contributed towards their deaths. However, they have said that the COVID-19 symptoms can really rapidly worsen, and anybody who is infected that has this sort of situation happen to them to get urgent medical help really quickly. They have also been given a bit of a broadside by the Union for Ambulance and Paramedics. Danny Hill, who is the secretary here, has said that this Northcote woman who died, unfortunately, there were paramedics in full PPE, also police that attended. 6 police were originally stood down, but the 2 that entered into the house were wearing full PPE, so they have since all been cleared. But only hours after this had happened, paramedics were called to the same house again for another person within that home who was also sick, and they weren't notified at that stage that this was a coronavirus hotspot. Now, Danny Hill says that this situation is really intolerable, that emergency services, first responders, need to know what sort of situation they are walking into. At the moment, there is no way that the emergency services can find out what the coronavirus hotspot or COVID status of particular patients are, and he's calling for at least the ESTA system, which is our 000 call-taking system, to be provided with a list of these so that they can be on their guard, notwithstanding the fact that they're wearing PPE, that they can still be aware that they are potentially dealing with a highly infectious site as well.
Okay, Steph Ferrier reporting there from Melbourne.